They could go to an elderly living facility. Those are those places that are like apartments. They have some added level of care. They may have a nurse that can come by and go ahead and help them with their medications. They have house cleaning services that can come in. They could have assistance to getting to a dining area where they can go and get their meals, but they could still have a small kitchen area where they could do their own preparations in there. Home for the aged or extended care facilities. So you don't see too many of the home for the aged around anymore. They used to be almost like group homes where people could get the level of assistance they needed just to go ahead and get through the daily activities. They may be in a boarding room type of setting. More you're seeing that now in the custodial level of care in the nursing home. For those of you who have gone to nursing homes, you can know you can go to the same facility. You can walk down one wing, it'll be skilled care. That's where they'll have the nurses providing some level of intervention, or they're getting therapy on a regular basis. And then you go down the opposite end of the hallway and they're in a custodial level of care. They're being dispensed the medication by the same nurses. They're getting the same intermittent therapy if they're on custodial level. They're getting the same type of housekeepers coming through there, but depending on which part of that facility you're in, they're either getting coverage from their insurance plan if they're under skilled care, or they're paying it on their own if they're in their custodial care. Some patients will go home with home health, so that means they have some level of skilled care. They may not need it on a daily basis, but they need some assistance, and a home health nurse or a therapist is coming into the home on a regular basis to provide that expertise that we talked about that would meet the definition of skilled care. Skilled nursing facilities are the typical thing when we think of a nursing home. Those are where they're going to get therapy on a regular basis. They're getting some sort of nursing care on a daily basis. It's some type of regular intervention from those skilled personnel that we talked about. And then the Cadillac of services for therapy would be the inpatient rehab facilities, like you have here at Carle. They would be the facilities where they're going to get intense type level of therapy. They're going to have physician supervision, and they're going to need a higher level of care, and they're going to be a little sicker than some of the patients that are going to go to a skilled care facility or go home on their own. So when they have daily custodial needs, remember those are just those day-to-day activities, the things that people need to help them get through their activities of daily living. They can all be delivered in these type of settings. The home, the alternate living facility, the extended care facility, or the typical nursing home, or home with home health and therapy. But often these people are going to require some level of non-skilled support on a daily basis. And the amount of time they're going to need is going to vary depending on their other needs or situations. So the trouble that you all run into when you're looking at those denials for skilled level of care and you're trying to figure out where are these people going to go, or what resources are going to be available to you if they leave your hospital and have to go somewhere else, and we are not going to cover them to go to the nursing home and pay for their room board. So the best resource you probably have in your facility is going to be your social workers. The social workers are going to know what these community resources are. And in fact, when I was preparing this talk, it was a Navi Health social worker that I talked to find out what was available in the Champaign-Urbana community, since I don't practice here. And she gave me some of these resources, and your social workers will have the same amount of information that you can go ahead and access to them. When I was seeing patients regularly in the hospital, the social workers were always the people that could help me figure out what resources were there when it was something other than just the medical or skilled interventions that I was